Hello and welcome to a very relevant and important discussion on GDM, also called gestational diabetes mellitus. It is something that has shot into prominence into some years now. It is crucial for pregnant mothers to manage this in the interest of the newborn baby's health. How does it affect the body? Its repercussions, prevention, and a host of other related issues are something that we are focusing on today. I have a very eminent panel of doctors to discuss this with me today. Subject is GDM Decoded, Symptoms, Solutions, and Sustained Well-being. I would like to welcome our panelists on the show. We have with us Dr. Ipsita Ghosh, consultant endocrinologist, Narayana Super Speciality Hospital, Howrah, and Assistant Professor, Department of Endocrinology, RKM SVP BIMS, Kolkata. We also have with us Dr. Jayshree Swain, Consultant Endocrinologist, Professor and Unit Head, Department of Endocrinology and Metabolism, IMS and Some Hospital, Bhubaneswar, Odisha. We also have Dr. Parjeet Kaur, Associate Director, Department of Endocrinology and Diabetes, Medanta, the Medicity, Gurgaon. A very warm welcome to all our three esteemed panelists. So with this, I would like to start with Dr. Ipsita Ghosh. What exactly is GDM or the gestational diabetes mellitus? If you could explain this in simpler words.
GDM is a type of diabetes that occurs only during pregnancy. So it happens when the body cannot produce enough insulin to meet the increased demand during pregnancy. So GDM usually develops in the second or third trimester of pregnancy and it resolves post childbirth. And what happens is it increases the risk of developing complications in both mother and the child. And also, a patient suffering from gestational diabetes is also at a higher risk of developing type 2 diabetes later on in life. So, it's a very important aspect in pregnancy.
So, why is early detections of this issue of GDM so important for the mother? Dr. Jayshree, if you could share your views on that.
We detect gestational diabetes at 24 to 26 weeks of this pregnancy. But when there is high risk, we detect that things early. That means in first prenatal visit or antenatal visit. What do you mean by these high risks? High risk category includes those who have the past history of diabetes or family history of diabetes, past history of gestational diabetes or overweight obesity before this pregnancy, history of a big baby more than 4 kg in previous birth, or history age more than 25 years, or this history of hypertension or cardiovascular disease. In this case, we are going for these early detections of the gestational diabetes. It has a great crucial role in the early detection because we know gestational diabetes is well correlated with this hypertension. 1.5 to 2.5 times increased risk of this hypertension in gestational diabetes. And hypertension lead to this, it is called pregnancy induced hypertension. It may lead to the preeclampsia and eclampsia, in which organ failure of this mother is there. So early detection of the diabetes allow us a time for this proper treatment and management of this mother, so that we can reduce this maternal mortality, morbidity, and so also this fetal morbidity and mortality. And again, another important point is there. We by early doing these screenings, we can pick up this pre-gestational diabetes, so that we can minimize and we can have a proper treatment of this pregnant mother.
Right. So, Dr. Jayshree has shed some light, but Dr. Parjeet, I'd like you to focus more on the baby's health. How does it affect the baby's health if the mother is detected with GDM?
So GDM, if I would say detected but not managed properly, or if the blood glucose levels are not controlled in the mother, can definitely affect the baby in many ways. One of it is called macrosomia, which means that the baby's size becomes very large because of the uncontrolled blood sugars. Baby size become large, and that can create a lot of problems during the birth, and birth injuries can happen. Number two, it can also cause preterm deliveries. Before the term, the deliveries can happen because of the various reasons. And number three, it can also lead to stillbirths. So this is also pretty common if the blood sugars are not well controlled. This is during the pregnancy, but even if the baby is delivered healthy, even the post delivery, or what we call neonatal complications, can occur. One of is it called neonatal hypoglycemia, which means that the mother sugars are high. Baby starts producing a lot of insulin, which can drop the blood sugar of the baby immediately after the birth. It can also lead to respiratory distress syndrome, where the baby feels difficulty in breathing and it can need actually ICU stay. And it can also lead to prolonged jaundice. So all these complications can lead to a prolonged ICU stay of the baby.
Oh, that's quite critical. Dr. Ipsita, when should a pregnant woman be screened for GDM?
Pregnant women typically they are screened between 24 and 28 weeks of pregnancy, but few cases where there are a little higher risk. For example, those who had a previous history of gestational diabetes, those who are obese, who has a family history of diabetes, age more than 45, previous history of a big baby or a macrosomic baby, a child of more than 4 kgs. Then, if the person had PCOD prior to the pregnancy, they need to be tested a little earlier, preferably antenatal or prenatal, that we say. And even in the first trimester, we usually, if the patient comes to us at the first trimester, we usually test then and there as well. So we usually do a oral glucose tolerance test in these individuals, and we have a cutoff after which we call these patients gestational diabetic patients.
Dr. Jayshree, are there any common symptoms that can help a pregnant woman detect that she might be having GDM? Some common symptoms that could be easily identified?
For the GDM patient, they don't have any noticeable symptoms. That's why we are doing this screening or testings early to detect this diabetes. But sometimes, however, these pregnant women, they may feel the classical symptoms of the diabetes, which is outside of the pregnancy, like polyuria, excess urinations, polydipsia, excess thirty and drinking of the water, polyphagia, excess eating, and sometimes they may have weakness or excessive fatigue and increased risks of these infections like urinary tract infection, vaginal infection, vulval infection, fungal infections are very common in that diabetic or gestational diabetes groups. Nausea and vomitings. It is usually in pregnancy, but it is out of, if it is disproportionate to that of the pregnancy or morning sickness, we can suspect. And sometimes there is excess weight gain in mother or weight loss in mother, or if the baby is out of proportion, it is growing large, which we will detect by this ultrasound. In that case, we and sometimes there is a blurring of the vision is there because of the in disturbances in the fluid and lens swelling is there. In that case, we may suspect that this lady is suffering from the gestational diabetes, and we are doing screening or other tests.
Right. Now, since we've understood the common symptoms that could happen, I would like to know how can GDM be prevented? Dr. Parjeet, if you can share your thoughts on that.
Yeah, so knowing all these complications, the good part is GDM can be prevented. For that, we must know, first of all, what are the risk factors for GDM? Who are all the ladies who are at risk of GDM? So there are many risk factors, out of which one is the most important is the being overweight or obese. So someone who has obesity, overweight has high likelihood of GDM. If there is a family history of diabetes in the family, if the lady has a PCOS history, polycystic ovarian syndrome history in the past, or if the lady has delivered a large baby in the previous pregnancy which went where the GDM went undetected, is also at high risk of gestational diabetes mellitus. So it's important to recognize these risk factors and take appropriate action before she plans to conceive. So it's important that before she plans to conceive, she need to control the weight with healthy diet and regular exercise. Similarly, early detection is equally important. Get all the blood works done. So it's important to check the blood glucose levels well in advance before she plans a pregnancy. Because if the pre-diabetes gets picked up, then it's very likelihood that she will develop gestational diabetes mellitus. So important steps includes the screening, getting the blood work done, a healthy lifestyle, I think is the most important one. Before pregnancy, during pregnancy, after pregnancy, a good diet, a healthy diet, and a regular exercise. It's very important to prevent gestational diabetes.
Right. A healthy diet always goes a long way in ensuring well-being. Dr. Ipsita, if a pregnant woman has been diagnosed with GDM, what else can she do to manage it?
So management involves regular blood testing. The blood sugar levels needs to be tested, and we have to keep within the targets. That is fasting less than equal to 95 milligram per deciliter. 1 hour post meal has to be less than 140 milligram per deciliter, and 2 hour post meal has to be less than 120 milligram per deciliter. To maintain this, we need to obviously go for a healthy diet, healthy and balanced diet, which should include lean proteins, complex carbohydrates, and healthy fat. Now, we need to limit the refined sugars as well as processed food. We need to increase whole grain fruits and vegetables. This is regarding the balanced diet. Now, regarding the regular exercise, we need to exercise, at least go for a walking for 30 minutes, or we can do some yoga. We have pregnancy related yogas which can be used in this situation. As also, we can go for swimming. So these are regarding the exercises. Now, if diet and exercise cannot control your blood sugar levels, we need to put you on medications. So medications include insulin, and sometimes we do use metformin. We need to regularly check our sugar levels. Number one, we need to keep ourselves healthy. A healthy lifestyle needs to be followed. Again, no addiction. Again, that is very important. And the other important aspect is regular fetal monitoring. The fetus needs to be monitored at regular interval. We need to go to the doctors at regular intervals so that our gestational diabetes is under control.
Right. What if GDM once happens? Does it go away after birth, Dr. Jayshree, or does it remain?
In most of these cases, GDMs, after delivery, the blood sugars is coming down to the normal level, because we know, as we have discussed thoroughly, the GDM is the interplay of the some of the risk factors and interplay of the hormone. So after delivery, the blood sugar is coming down to the normal. But there is higher risk of developing type 2 diabetes of the gestational diabetes, those who are suffering from the gestational diabetes. And if you look to the data, there is these gestational diabetes peoples, they have this risk of 3 times, lifetime risk of 3 times suffering from this type 2 diabetes as comparison to the non-gestational diabetic mother. And again, 50% of this type gestational diabetes, they will develop type 2 diabetes within the 5 to 10 years of their lifespan, if they are not going to do these lifestyle modifications like diet, exercise, meditations, pranayams, yoga, and all other lifestyles, avoidance of the stress. So for that things, we need a regular screening at 6 to 12 weeks postpartum. We do an OGTT test, and if it is normal, we do after 1 year, and regular follow-up for the gestational diabetes after this delivery is very much essential, because of the high risks of suffering of type 2 diabetes later. But after delivery, most of these diabetic patients, gestational diabetes patients, they are coming down to, their blood sugar is coming down to this normal.
After talking about the mothers, I want to focus on the baby's health. Are there any long-term health risks for the baby if the mother has had GDM, Dr. Parjeet?
Yes. In fact, baby can also have long-term effects if the baby is exposed to high blood sugars in the womb of the mother. So these babies born to GDM mothers can actually become obese and overweight. So this obesity can start right from the childhood. What we seeing these days, a lot of childhood obesity. So children can become obese and overweight. And also later in life, they have very high chance of developing type 2 diabetes. So they almost have 6 to 10 times higher chance of developing type 2 diabetes of these babies who are born to GDM mothers. And along with this diabetes and obesity, there is a whole lot of metabolic syndrome which these kids can develop. Like they can have high blood pressure, high cholesterol levels. In fact, there are some data to show that these children can also develop a lot of heart diseases, cardiovascular diseases also in the future. It's very important that we carefully monitor these kids and promote very healthy lifestyle right from the beginning, right after the birth, that we need to promote a good healthy eating, a regular physical exercise, and also keep a check on their weight. It's important to notice that we tend to ignore the weight of the kids, seeing that okay, they're healthy, but keep a regular check on their weights and detect obesity the right times to prevent type 2 diabetes and later on metabolic syndrome in these children.
Right. In India, there are many cultural beliefs and food habits that we see during pregnancy. How does this affect a woman's uh, health having GDM? Dr. Ipsita, if you can share your thoughts on this.
So we usually encourage pregnant women to take sweets, fried foods, heavy meals. Like you shouldn't keep your tummy empty. You have to eat for two persons. So these are the regular beliefs or regular cultural beliefs that we have. but this will only increase the chances of having gestational diabetes, and more importantly, mother's weight, it increases. So we need to monitor the weight gain in the mother as well. So what we need to focus here is balanced diet, healthy diet, which should include fruits and vegetables, complex carbohydrate, whole grains, and lean protein. And also, this is we also encourage our pregnant ladies to take ghee and butter to increase the weight of the child, especially in the third trimester, which is also not required. So we need proper education that these are not a must for every pregnancy. We need to look into the balanced diet and a healthy lifestyle rather than putting these patients on, or pregnant ladies on, junks and oily food or food with increased sugar levels. So monitoring weight gain in the mother as well as a healthy balanced diet is something which is of utmost importance.
I think this is very, very relevant what you said, because this also busts the myths about taking oily junk food or, the heavily fried and sugar-led food. So thank you so much, all the panelists. It has been a very eye-opening discussion on the subject of GDM that needs to be focused on, especially by pregnant mothers, not only in their own interest, but also in the baby's health as well, because it affects both the mother and the newborn long term as well. Thank you so much for sharing your precious time and sharing this valuable knowledge with us and our audiences.